Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM, a cardiologist. The featured presentation is Can Risk Factors Modification Reverse Coronary Artery Blockages or Coronary Artery Disease? The key word is reverse. There's a lot of debate about whether changes in the lifestyle and reduction of risk factors, whether that would reverse the coronary artery disease or the disease progresses as it is. I asked Dr. ChatGPT. All these years we've been asking Dr. Google for opinions, but this time I decided I'm going to have an interaction with ChatGPT and look for what ChatGPT knows about the reversal of coronary artery blockages. Remember the keyword reversal, because there are even medical specialists who claim they can reverse the coronary artery disease. My concern is, where is your evidence? Called up Dr. ChatGPT to show me the evidence, and you'll be surprised as to what we find out. So please do watch this. Before we go any further, I would like to introduce to you my cardiology rotation manual, about 250 pages of latest information with reference to cardiology subject, which is useful for medical students, nurses, doctors, internists, primary care doctors, emergency room physicians. And you can get a free copy of this, and I will tell you at the end of this presentation how you can get a free copy of this 250-page PDF book which I have created. Let's get back to the original question. Can risk factors modification reverse coronary artery blockages? So let's see what the response from the ChatGPT was and what evidence in the literature is there at this time to either agree or disagree with this statement. Every 5 adults over the age of 65 may have some degree of coronary blockages. Whether they are symptomatic or not, that's a different story. The plaque starts building up from age 20 all the way up to 60, 70, 80 years. And when it gets to be totally blocking the artery, that's when it causes the heart attack. So the first question I asked ChatGPT was, can risk factor modification reduce coronary artery disease? Maybe I didn't ask a specific question, which I have it in the title. So it came up with this standard answer. All these risk factor modifications can reduce the coronary artery disease, which is partially true. If you take people in their 30s and 40s, who have these major risk factors, and you put them on regimen of diet, exercise, smoking cessation, and weight control over the next 5, 10, 15 years, they are going to have reduced incidence of coronary artery disease compared to those people who did not follow the risk factor modification, versus those people who did not follow the risk factor modification. So that's a totally different question. My question was, so I tried to be a little more specific. Can risk factors, it even accepts bad spellings, which is kind of nice. Can risk factors reduce the degree of coronary artery stenosis or shrink the plaque that is already there? It says it's not possible to completely shrink or eliminate the plaque that is already present in the coronary arteries. That's like a general statement, but I need evidence. So again, it goes around saying, if you modify the risk factors, you can reduce the rate of progression of the coronary plaque buildup. So say, for example, you have a 60% blockage, which may not be significant from a medical point of view in terms of causing symptoms. And if you drastically reduce your risk factors, it may not progress to 90% over a given period of time if you follow the risk factor modifications, compared to someone who may have the artery stenosis go to 90% in a certain period of time. So in other words, it reduces the rate at which this plaque buildup progresses, which is good, but it doesn't reverse. If you have a 70% blockage, it is not going to reverse it to like 0%. If that's what some of your experts are projecting, or some of your specialists are telling you, okay, you got 70% blockage, we're going to modify this with diet, exercise, all these things, and we can reduce your plaque size to 10-20%, then I want to see where is the evidence. That's what I was stressing ChatGPT more and more specific questions to see if it has any evidence in the literature to suggest what I am looking for. All right, so can risk factor modification open totally blocked coronary arteries? Which is a very obvious question. And of course, it's generally not enough to open the totally blocked artery. The only way we can open up a total blocked artery is by doing stent in placement. It may not be successful in every patient, or the other option is to bypass the totally blocked artery with bypass surgery. All right, so I said, so when people say they can reverse coronary artery stenosis with risk factor modification, where is their evidence? So I'm trying to dig up from ChatGPT in many different ways to see if there is any study or a randomized control study that shows, yeah, if you do these things, your plaque size can go back from 80% to 30% or 40%. So it was just going around circles, and it says, more robust studies, evidences suggest risk factor modification in a large randomized control studies can reduce heart disease in the population in the future, and it also decreases the rate of progression. It still didn't answer my question. So what I did was I kept pressing for that. What are the references that show aggressive risk factor modification can slow down or even reverse the progression of a coronary artery disease? Then it came up with one study, just one study I'm telling you, by Dean Ornish, that was published in 1990. There are other studies like statin studies have been shown to stabilize the unstable coronary plaque, as we call it. It's the unstable coronary plaques that can break, and blood clot can form on top of that, and that's how people end up getting a heart attack even if they have 60 or 70% blockage. So that's a different story, where statins have been shown to stabilize this plaque, but this is highly experimental study, and that doesn't apply to the general population. But the implications do apply. That means people who have coronary artery disease need to be on statins. It acts as an anti-inflammatory agent, it reduces the LDL cholesterol, and it helps to stabilize the coronary artery plaque. But my question was, can it reverse coronary artery disease, as some experts may claim? So the ChatGPT came up with one study. I'm holding two fingers. One study that is by Dean Ornish, and here are some of the description, some of the evidence presented. This was presented by Dean Ornish in 1990. I've been in practice since 1980, so I followed very closely Dean Ornish's studies, and his diet is based on 7% total fat intake, which is almost impossible for the general population to follow, along with that calorie reduction and carbohydrate reduction. And if you can do all those things, sustain that for decades. So it's not a practical solution. This study involved only like 48 patients, which was involved in this study, and lifestyle modifications included low-fat vegetarian diet, exercise, stress management, and social support. Since 1990, and more than 30 years, no other studies have been done to substantiate the claim that was made by Dean Ornish. And as I said, his regimen is so strict, it is very, very difficult for majority of the American population to follow. So that's where we stand, ladies and gentlemen. In conclusion, can risk factor modifications reverse coronary artery disease? The answer is no, from the evidence based on the literature as of today. It reduces the rate of progression of the coronary blockage, in patients with existing coronary plaques. If we were to reduce risk factors drastically in the young population, as they get older, they have lesser incidence of coronary artery disease compared to those who don't follow the risk factor modifications. And finally, statins have been shown to stabilize a vulnerable or unstable coronary plaque. So that's where we stand, ladies and gentlemen, as far as totally reversing the coronary artery blockages that are already there in a patient with coronary artery disease with diet or any kind of risk modifications. It is not substantiated by any clear-cut randomized control studies as of this video presentation, which is March 2023. We may see some evidence in the future, but right now we don't have any evidence. So if someone claims that their risk factor modification program can reverse the coronary artery blockage that is already there, like if you have 70, 80, 90% blockage, it can reverse, I would ask them, show me your reference. Thank you so much for watching this presentation, ladies and gentlemen. If you would like to get a copy of my cardiology rotation manual, which is useful for students, nurses, doctors, internists, fellows, medical residents, and primary care doctors, emergency room doctors, just send an email to drniknikam. I know it's kind of real tiny here, drniknikam @gmail.com, and I'll be more than happy to send you this booklet. We have more than 300 educational videos on the topic of cardiology. Please do watch them, and please do subscribe to our YouTube channel, and I will see you in the next presentation.